Let's do another fat grafting fact. So if you have fat grafting of the breasts, you're going to look crazy for a while. When we do fat grafting, we weave the fat throughout your breast tissue, multiple trajectories, multiple layers, and this is done blindly so we can't stop bleeding. So it's a lot of passes, a lot of inflammation, potential bruising. So you look great on the table typically, but as soon as you go home, that swelling will set in. And usually by a day or two after surgery, you are a large, swollen, amorphous blob. Now this can be really alarming if you're not prepared for it. So the swelling will go down, but it swells a lot. And the other thing to consider is that many patients are very bruised and many patients have areas of redness. Now the redness can be just some bruising, but it also can be from fat necrosis. So you always lose some of the fat, and when your body reabsorbs it, it's inflammatory, and so there tends to be a lot of blotchy redness, and this can masquerade as an infection. So here's a lovely patient of mine who had asymmetric fat grafting. So she had more fat grafting on this side than that side. Look how red this breast looks. So it really looks like it could potentially be an infection. And that is very common in fat grafting patients. I'll show you a few more photos. Here's another patient of mine a couple days after surgery, and you can see all of the bruising, and there's also a lot of redness. And then here's a patient who also had asymmetric grafting. So look at all the bruising and redness on this side compared to the side with less grafting. Here's another photo from the side so you can see how impressive it can look. So when you're healing from fat grafting, it's really important that you stay in contact with your team because we can't always go off of appearance of your breast. We have to watch your symptoms. It's very common for your breast to feel heavy and full while you're swollen, but it's not common to have fever, shortness of breath, or things that may cue us that you are developing an infection. It's rare in fat grafting, but it certainly can happen. And then it's also important to point out that all of this swelling makes your breast look very large. Don't fall in love with that size because it's going to go down significantly, and we want you happy with your ultimate results.